and welcome to part 2 of our Trachoma Live series. I've got a really special guest in for you today from Geneva in Switzerland. He is the medical officer who's responsible for the global elimination of trachoma by 2020 program, a mouthful, at the World Health Organization. He's an Australian who undertook his medical training in Brisbane and then moved overseas for a very long time, hasn't really returned to Australia, but he's worked in a couple of African countries and was the chief scientist to the global trachoma mapping project. Join me in welcoming Dr. Anthony Solomon. He'll appear shortly. Hi, Dr. Solomon.
Good morning, Lien. How are you?
Good afternoon. I'm good. Thanks for joining us on our show today. Now, Rotarians really want to know and understand trachoma, what it is, and I think you're probably one of the best people in the world to be talking about trachoma, so I thought it would be great to have you on. So thank you for joining us. Can you tell us what trachoma is?
Trachoma is the most common infectious cause of blindness. It's a disease that occurs in very poor, remote, rural communities in general, particularly in the most impoverished places in Africa, Asia, South America, and also still in Indigenous communities in Australia and the Torres Strait.
Yeah. So how does it impact people?
Well, it's a disease of the community, really. It blinds the poorest people in the poorest communities, as I say, and so takes those people out of productive employment, stops them being able to contribute in the way that they would like to. The kind of services that are available to people who have visual impairment in the developed world are typically not available to them, so they're not able to function as they would like to. And because those services aren't available, it tends to take another member of their family out of productive work or schooling as well in order to help them get around and do their activities of daily life.
Sure. And so in terms of management, I know the World Health Organization has a strategy, and a strategy that has come together from a whole lot of institutional research. Can you talk a bit about this strategy?
Yeah, since 1993, WHO has recommended a package of interventions to control and eliminate trachoma. And that package of interventions is called the SAFE strategy, SAFE. It's has 4 parts: surgery, which is the S component, surgery for individuals who have advanced disease, that's trichiasis; A, which is antibiotics to clear infection; F for facial cleanliness; and E for environmental improvement, particularly better access to water and sanitation. Those things are in that order, not just because they make a good acronym, but because S is the most urgent thing. People who have trichiasis or inturned eyelashes are going blind now, and they need an operation in order to deal with it and to prevent them from losing further vision, and so on. The A, F, and E components are slightly less urgent, but also extremely important.
Sorry, Sal. I'm back on. Can you hear me? Hello?
Hi, Lien, I'm still here.
Oh, good. Can you hear me?
I couldn't before, but I can now.
Okay, great. So can you just talk to us about the trachoma, the bacterial infection of trachoma, and how antibiotics treats the infection? But, you know, how often do the eyes need to be infected before blindness sort of takes place?
Well, what we know is mostly from mathematical models, and those models suggest that one would need in excess of 150 infections over the course of a lifetime in order to go blind from trachoma, in order to start losing vision. It requires a cycle of infection and resolution of infection in order to lay down some conjunctival scar, and it's the accumulation of that scar that leads to trichiasis and then later visual impairment. And as I say, we think you might need 150 infections, so that's quite a lot, and it means that it's kids who are in communities who are infected all the time, every day or every week, that are at risk of developing trachomatous blindness in later life.
Yeah. And so how important are those public health interventions in the SAFE strategy, the facial cleanliness and the environmental improvement?
We think they're extremely important. You know, trachoma used to be a problem in Europe and North America. Many of the big eye hospitals of the world were founded originally as trachoma hospitals, including the Royal Victorian Eye and Ear Hospital in Melbourne. And, you know, trachoma disappeared from Australia, the non-Indigenous communities from London, from New York and San Francisco, not because people started using antibiotics, but because they had better access to water and sanitation. We think that those F&E components are extremely important in getting rid of the disease and keeping it away.
Sure. And so can you tell us a bit about the countries that are still infected with trachoma or have trachoma as a public health problem, and the countries that have eliminated trachoma to date?
There are still 42 countries, we think, that have trachoma as a public health problem and need interventions to prevent people going blind from it. And there are a number that have kind of finished interventions, we think, and are ready to go through a formal process of being validated as having eliminated the disease. Over the last few years, we've been able to get 5 countries officially through a process to acknowledge the fact that they have eliminated trachoma, and those countries are Morocco, Oman, Mexico, Laos, People's Democratic Republic, and Cambodia. And there are hopefully a few more countries that we'll get through this year.
And these countries have achieved elimination through the SAFE strategy, haven't they? And these countries have achieved elimination through the SAFE strategy. Is that right? Yes,
that's right. Yes, so they've all been able to implement the SAFE strategy and get rid of the disease.
And so what's it going to take for Australia to be able to eliminate the disease?
Well, first of all, it needs to be thought about, and there are a number of committed partners who are doing that in Australia and who have been doing that for a long time. It takes political commitment to want to implement the SAFE strategy, and it takes resources and community engagement. But there are others who have worked more in depth in the Australian context and know the Australian situation much better than me. And I think some of those are guests who will be later in later episodes.
Yeah, totally right. And we've just got a comment here asking whether trachoma is present specifically in a remote community of Kintore. We've got Professor Hugh Taylor on tomorrow to talk about trachoma in Australia. So I think, Rebecca, will be able to answer your question then. Dr. Solomon, last question. Do you think Australia will be able to do it by 2020?
Yes. Yes, I do.
Great. I hope so too. Thanks for joining us, Dr. Sol, everybody, from the World Health Organization.
Great pleasure.
Sorry about that, Sol. Thanks for joining us. As I mentioned, we've got Professor Hugh Taylor on tomorrow at 5 o'clock in the afternoon. It's going to be all about trachoma in Australia. He is leading the effort in our country, and I look forward to presenting with him tomorrow. Thanks for joining us. See you tomorrow.